COVID hit us on so many levels.
We were hit very hard.
It was not easy to understand in the beginning.
There was a lot of fear and there was a lot of misinformation.
So a lot of people dying.
Everything shut down.
Partnering for Vaccine Equity.
The Partnering for Vaccine Equity program was created to increase education, access, and acceptance of vaccines.
Catherine Zilber,
Early on in
MSc,
the
VP,
pandemic,
Infectious Disease Program, CDC Foundation.
COVID did not impact everyone equally. So when vaccines did become available, we wanted to ensure that communities that were most in need, migrant, refugee, people with disabilities, minority populations, had the information and the access.
In 2021, the CDC Foundation provided funding and support to CBOs, community-based organizations across the country. CBOs understood the needs of the people in their neighborhoods and were ready to take action quickly. In the program's first year, 110 CBOs were selected from over 500 applications. Now, Lantern Community Services, New York City. Supportive housing for individuals and families impacted by homelessness. Carol Lemus, Assistant Vice President of Health Programs, Lantern.
When we started this project, we had about a 12% vaccination rate among our residents.
As residents were especially vulnerable to the spread of COVID-19, Lantern brought vaccination clinics to each of its buildings.
We recruited about 25 of our residents who became vaccine ambassadors, went through an extensive training that covered vaccines in general, COVID, flu, myths.
Cynthia Hairston, Resident Vaccine Ambassador.
They call me the mayor because I know everybody business.
Irene Walcott, Lantern.
The majority of our tenants are Black and brown folks who haven't had positive experiences with healthcare, positive experiences with government institutions.
My job was to go around to doors, giving people information. We gave out flyers. We did tabling also.
Children and Family Resource Services, Central California, partnered with the Santa Barbara County Promotores Network to bring much-needed services to rural Cuyama Valley. Barbara French, Department of Social Services, Santa Barbara County.
The issues in Cuyama are often getting the information out. Most of the people work in agriculture. They're spread out over a large area.
Josefa Rios, Promotoria, Santa Barbara County.
It's very hard for the members in this community to trust outsiders.
To inform and engage the public about their first mobile vaccination event, organizers relied on promotores, trusted community health workers in the Hispanic community.
The promotoras are the key person to go in and connect them, knocking on doors and passing the flyers. They trust the promotoras. Also for the vaccines, if you're going to register electronically, the internet here is not the best. A lot of the communities, they don't have a device to register either. When again, the ladies go out there, they have a sign-in sheet, and we got people registered on a day. 48 people got vaccinated.
Able, South Carolina, increasing equity for all people with disabilities. Ebony Deloach, Disability Access Leader.
The first time that the vaccine became available, it wasn't easily accessible. When you spoke to a representative and explained to them that you were a person with a disability, they didn't really seem knowledgeable about how to help you. It was a lot of hoops that I had to jump through to get that first one. When I got the shot through Able, South Carolina, it was so different.
Able, South Carolina designed and implemented barrier-free vaccine clinics to be easily accessible to all.
They came up with a lot of strategies to run a barrier-free vaccine clinic because they never done it before. I felt at ease because it was just so welcoming. Everyone was friendly. You know, it's just refreshing.
In our first 2 years of the program, the number of people that we've been able to reach directly, yes, it was extraordinarily successful.
Our vaccine ambassadors were so successful that in less than 6 months, they more than quadrupled our vaccination rates.
Within 1 year, Lantern achieved a vaccination rate of nearly 90% across its 16 supportive housing sites.
I'm very grateful for all the work that Able SC has done.
Able, South Carolina held 7 accessible vaccine events in 2022. Its blueprint for a barrier-free clinic has been adopted by many organizations.
Just the satisfaction of serving my community it's 100% worth it.
Thanks to the tireless promotores, more than 600 people a month have attended their vaccine-related events.
We're in the process of renewing our agreements with our partners to move into the third year and ensuring that we're maintaining and building those relationships. We're very excited.
In the first 2 years of the program, the efforts of CBOs funded under PAVE have resulted in 219,000 vaccinations. The program continues to support vaccinations in communities across the country. CDC Foundation, together our impact is greater.